Think your foot pain is just from a long day on your feet? It might be something much more serious. For millions of people with diabetes, the first signs of hidden danger start in the feet, and most don't even realize it. It's easy to brush off tingling, pain, or even numbness as simple wear and tear or aging. But when you're living with diabetes, those symptoms could be warning signs your body can't afford to ignore. Diabetes quietly affects your feet in two major ways. First, by damaging the nerves, a condition known as diabetic neuropathy. This can make it hard to feel pain, heat, or injuries. Second, it reduces blood flow to your feet, making it harder for even small wounds to heal. That combination is dangerous. A tiny blister, unnoticed cut, or sore spot can quickly turn into a serious infection or foot ulcer. And in severe cases, untreated foot complications can lead to hospitalization or even amputation. But here's the good news. Most of these issues can be caught early and managed if you know what to look for. In this video, we're breaking down 7 foot symptoms that could reveal hidden diabetes problems. These signs might seem small, but recognizing them early could save your feet and maybe even your life. Let's get into it. Symptom number 7, foot ulcers or open wounds. One of the most alarming signs of diabetes-related foot problems is the appearance of foot ulcers or open wounds. These usually show up on pressure points, like the heels, the balls of the feet, or even under the toes, areas that experience the most stress during walking or standing. What makes foot ulcers especially dangerous is that they often don't hurt. Due to diabetic neuropathy, which damages the nerves in your feet, you might not feel pain even when the skin breaks open. That means you could have a developing ulcer and not even know it's there until it gets worse. These wounds may start out small, like a blister or red sore, but without proper care, they can grow deeper and become infected. Infections in diabetic feet can spread fast because poor circulation limits your body's ability to fight off bacteria and heal the wound. Left untreated, foot ulcers can lead to serious complications, like gangrene, hospitalization, or even amputation. That's why it's critical to inspect your feet daily if you have diabetes. Look for any cuts, sores, discoloration, or areas of swelling. If you notice a wound that isn't healing within a few days, or any signs of infection like redness, pus, or a foul odor, seek medical attention immediately. The earlier you catch it, the better your chances of healing without complications. Foot ulcers are not just a skin issue. They're a red flag that your diabetes may not be under control and needs urgent attention. Symptom number 6, fungal infections between toes. If you're constantly battling athlete's foot or peeling, itchy skin between your toes, it might be more than just a hygiene issue. It could be a hidden sign of diabetes. Fungal infections like athlete's foot thrive in warm, moist environments. But when you have elevated blood sugar, your body becomes an even more inviting place for fungi to grow. High glucose levels can weaken your immune response, making it harder to fight off these infections and easier for them to keep coming back. You might notice redness, itching, flaking skin, or even cracking between your toes. The area may feel irritated or have a persistent burning sensation. While over-the-counter antifungal creams can provide temporary relief, the infection often returns if your blood sugar remains high. That's because you're not just dealing with a surface-level skin condition, you're dealing with a deeper issue. Diabetes creates the perfect internal conditions for fungal growth. Unless your blood sugar is well managed, these infections will be tough to eliminate. Left untreated, what starts as a minor fungal infection can lead to breaks in the skin, which opens the door to more serious bacterial infections. This is especially dangerous for people with poor circulation or nerve damage, who may not feel the worsening symptoms. If you notice persistent skin issues between your toes, it's time to take a closer look, not just at your feet, but at your blood sugar control. Catching this early and treating it properly can help prevent more serious complications down the road. Symptom number 5, ingrown toenails or nail infections. An ingrown toenail might seem like a small nuisance, but for someone with diabetes, it can quickly turn into something much more serious. When a toenail grows into the surrounding skin, it creates an entry point for bacteria. Normally, your body would fight off the infection and heal the area quickly. But with diabetes, poor circulation and weakened immune response slow the healing process and make infections harder to control. What starts as redness and tenderness near the nail can escalate into swelling, pus, and even a deep infection. Fungal infections are also more common in diabetic nails, causing them to become thick, discolored, brittle, or crumbly. These changes not only affect appearance, they increase the risk of further complications. The biggest danger? You might not feel the pain due to diabetic neuropathy. By the time you notice something's wrong, the infection could already be advanced. If left untreated, nail infections can spread to the skin, deeper tissues, or even the bone. In severe cases, they may require antibiotics, drainage, or even minor surgery. That's why it's critical to inspect your feet and nails regularly. Keep your nails trimmed straight across, avoid cutting them too short, and wear shoes that fit well to reduce pressure on the toes. And if you notice any signs of infection, like redness, swelling, or drainage, don't wait. See a doctor or podiatrist. When you have diabetes, even small nail issues deserve serious attention. Acting early can prevent long-term damage and keep your feet safe and healthy. Symptom number 4, foot deformities. Foot deformities may not show up overnight, but when they do, they're often a sign that diabetes has been silently damaging your nerves and joints for years. Conditions like hammer toes, where the toes curl downward at the middle joint, or Charcot foot, a serious complication where the bones in the foot weaken and collapse, are both linked to long-term diabetic nerve damage. Here's how it happens. Diabetes can lead to peripheral neuropathy, which dulls your ability to feel pain, pressure, or injury. Without that sensation, small injuries or misalignments go unnoticed. Over time, the structure of your foot begins to change. The arch may collapse, the toes may contract, and bones can shift out of place. Charcot foot is particularly dangerous. It starts with redness, swelling, and warmth in the foot, symptoms that many people mistake for a minor sprain or infection. But behind the scenes, the bones are weakening and breaking down. If left untreated, the foot can become severely deformed, making it difficult to walk and increasing the risk of pressure ulcers and infections. Foot deformities also throw off your balance, leading to falls or uneven weight distribution, which adds pressure to areas of the foot not meant to bear it. This makes you more prone to developing ulcers, especially on the sole or sides of the feet. If you notice any unusual swelling, changes in the shape of your foot, or difficulty fitting into your usual shoes, don't wait. Early intervention from a podiatrist can prevent the condition from worsening and possibly save your mobility. Symptom number 3, unusual foot odor. If you've noticed a persistent, unusual odor coming from your feet, even after regular washing, it might be more than just sweat. For people with diabetes, chronic foot odor can be a warning sign of something deeper, a hidden infection. When blood sugar levels are high, they create the perfect breeding ground for bacteria and fungi. Combine that with poor circulation and reduced immune response, and your feet become more vulnerable to infections that don't heal quickly or go unnoticed entirely. These infections often settle between the toes, under the nails, or in small cracks in the skin, producing a strong, unpleasant smell that doesn't go away with soap and water. You might not feel pain from the infection at first, especially if you're dealing with diabetic neuropathy, which dulls sensation in the feet. That's why odor might be one of the only early signs something is wrong. What's more, fungal infections like athlete's foot or bacterial overgrowth in moist, enclosed areas can linger for weeks or months if not properly treated. Over-the-counter sprays and powders might help for a time, but if the root cause, elevated blood sugar, isn't addressed, the infection often returns. So don't ignore unusual foot odor. If it sticks around despite good hygiene, it's time to take a closer look. A doctor or podiatrist can examine your feet for signs of infection and recommend treatment before it spreads or leads to something more serious. In diabetes care, even the smallest signs deserve attention. Symptom number 2, burning, sharp, or tingling pain. Have you ever felt a strange burning or stinging sensation in your feet, especially at night when you're trying to rest? That pins and needles, feeling, or even sharp, electric-like shocks might not be random discomfort. For many people with diabetes, this is a hallmark sign of diabetic neuropathy. This type of nerve damage happens when high blood sugar levels begin to damage the delicate nerves in your feet. At first, it may just feel like mild tingling or numbness. But as the condition progresses, the sensations can turn painful, burning, stabbing, or throbbing, often worse during rest or sleep. Unlike regular foot pain from standing too long or wearing tight shoes, This discomfort doesn't improve with rest or elevation. Instead, it can become a constant, nagging reminder that something deeper is going on in your body. And here's the critical part. This nerve damage can sneak up gradually. You might not notice anything until the pain becomes hard to ignore. Left untreated, diabetic neuropathy can eventually lead to numbness so severe you won't feel cuts, blisters, or even fractures, putting you at high risk for infections and ulcers. That's why these strange sensations in your feet should never be brushed off. If you're experiencing burning, tingling, or sharp pain, especially at night, it's time to talk to your doctor. Early detection of nerve damage can make a big difference in slowing its progression and protecting your feet for the long run. Symptom number 1. Loss of balance or coordination. Have you ever felt like your feet were numb or disconnected? Almost like they weren't fully under your control? You might find yourself stumbling or having trouble walking, even when you're not tired or distracted. This subtle symptom is often linked to nerve damage caused by diabetes, specifically neuropathy. As diabetic neuropathy progresses, it affects the sensory nerves in your feet, leading to a loss of feeling. You might not even notice that you're losing the sensation in your feet, but it can make it harder to sense the ground beneath you. This numbness can throw off your balance and coordination, increasing your risk of falls, which is a major concern as it can lead to serious injuries. What makes this symptom even trickier is how gradual it can be. You might not feel the full extent of the issue until it's already affecting your everyday movements. This makes it even more important to monitor your feet regularly and stay alert to any signs of imbalance or difficulty walking. If you notice yourself losing coordination or feeling unstable on your feet, don't ignore it. These signs could be early warnings of neuropathy, and addressing them early with your healthcare provider can help prevent further damage and keep you on your feet safely. Conclusion. To wrap it up, these foot symptoms might seem like minor inconveniences, but they could actually be early warnings of serious diabetic complications. From numbness and balance issues to ulcers and infections, catching these signs early can make all the difference in preventing further damage. If you've noticed any of these symptoms, it's crucial to check your feet regularly and consult with your doctor right away. Don't wait. Early intervention can help prevent serious complications down the road. Have you experienced any of these issues with your feet? Let us know in the comments. We'd love to hear your story. If you found this video helpful, make sure to like it, subscribe to the channel, and hit the notification bell so you never miss out on more life-saving tips to manage diabetes and improve your health.